आज हम start करते हैं उसको. So as I have told you that safe handling of chemotherapeutic agents. Now chemotherapy drugs are mostly hazardous drugs. Hazardous drugs is defined as an agent that presents a danger, which produces a danger to healthcare personnel due to its inherent toxicity. Because these chemotherapy agents all are toxic in nature. They can produce, they can be carcinogenic, they can be mutagenic, they can be teratogenic. Now you better know about carcinogenic, they can produce cancer. When the healthcare person come in contact with that drug, they may produce cancer to that patient. They may produce mutagenic, having the ability to cause a permanent change in an organism's genes. They may be teratogenic, means causing malformation of an embryo or a fetus. If someone is pregnant, so they may produce teratogenic. So these drugs are hazardous drugs. They have other some characters of these hazardous drugs also. Now through oral inhalational, dermal contact of these drugs, they can produce their hazardous nature. Oral, when you can inhale the fumes of these drugs, inhale through the nasal roots, you can inhale, and dermal in contact, when there's some drugs can be spread over the body of the worker, they can produce certain effects. So these are type routes of exposure of these hazardous to the healthcare person. That's why dispensing of these drugs must be aseptic controlled. Reconsider these drugs must be aseptic controlled, must be handled safely. Now, before going to that, preparing chemotherapy drugs, what you have to need? You need patient medication order or record, prescribed drugs, what regimen, mostly in cancer patients, the regimens of drugs has to be given, the cycle has to be given. So you must know about prescribed drugs, appropriate diluent, how they are diluents added to the solvents, medication labels, long-sleeved gown. Now you have to, the worker has to wear the long-sleeved gowns, chemotherapy gloves, face shield or goggles and face masks, 20 gauge needles, hydrophobic filter or dispensing pins. Syringe with lure lock fitting and needles of various sizes, IV tubing with lure lock fittings, 70% alcohol swabs, sterile gauze pads, plastic bags with hazardous drugs label, sharp disposal containers, hazardous waste containers, chemotherapy spill kits. These has equipments to be gathered before reconstitute of these chemotherapeutic drugs. Organizing drug preparation areas. Now, what type of area is required where these drugs has to be reconstituted or prepared? Now, prepare chemotherapy drugs in well-ventilated workplace. It must be airy, ventilated workplace. Perform all drugs admixing or compounding within a class 2 biological safety cabinet. I can show in next picture what type of biological safety cabinet is, or a vertical laminar airflow hood with a HEPA filter which is vented to the outside. Now what you need in the place, you need a safety cabinet in which you have to reconstitute, or a vertical laminar airflow hood with the HEPA filter which is vented to the outside so that the hazardous can be go out. If a class 2 safety isn't available, it is recommended to use a special respirator. If these two things are not available, now you have to respirator, you have to mask. I can show in next picture about respirators. Have a close access to sink, alcohol pads, gas pads, as well as chemotherapy hazardous waste containers, sharp containers, and chemotherapy spill kits. You must be near the sink, alcohol pads, or gas pads, as well as hazardous waste container. Now, after reconstitute, these containers may must be thrown in a waste container. It must have a separate type of container with the other drugs. Now this is a biosafety cabinet of type under which that drug has to be reconsidered or be prepared. You will further that these are the respirators doing that work. The person who are going to reconstruct a pharmacist or technician, he has to wear such type of respirators, such type of dresses. Without that, it is harmful for the person who is going to reconstruct the chemotherapeutic drugs. HEPA filters, high efficiency particulates arrest air. Now, HEPA filters are especially for air cleaning system has to be attached to that area. Again, this is a cabinet under which the drug has to be reconstituted. This is a cabinet. Now see how aseptically the person is going to reconstitute the drug. Must have to follow these conditions. Further areas. Now make sure that all hazardous waste containers are made of puncture-proof, shatter-proof, leak-proof plastics. They may not be punctured. Make sure that yellow biohazard labels are available for labeling all chemotherapy contaminated IV bags, tubings, filters, since make sure that red sharps containers are available for disposal of all contaminated sharps such as needles. Now what you have to wear protective clothing. Now protective clothing must be essential, must be worn by the persons who are going to reconsider the chemotherapy drugs, because these are the safety measures which has to be adopted. Essential protective clothing includes gowns, gloves, face shields, goggles, and a face mask should be worn. Gowns should be disposable, water resistant, and lint-free with long sleeves, knitted cuffs, and a closed front. Gloves should be disposable, powder-free, and made of thick latex or thick non-latex materials. Double gloving is an option when the gloves aren't of the best quality. Now, but they have gowns, they have to wear gloves. If the gloves are not as good quality, they have to wear double gloves have to be wear when they are going to prepare the chemotherapy drugs. Now, such person, technician is wearing such type of dress over this. Personal protection. These dresses has to be wear by the how they are going to reconsider the drugs. Now, similarly, they are doing their job while aseptic handling under this laminar hood, and they are near to sink is there. Whatever I have told you, precautions should be adopted, should be followed. Now, general measures at the local level, most healthcare facilities require nurse pharmacists involved in the preparation and delivery of chemotherapy drugs and care of the patient with cancer. Take care to protect staff, patients, and the environment from unnecessary exposure to chemotherapeutic drugs. Make sure your facility protocol for spill are available in all areas where chemotherapy drugs are handled, including patient care areas. Now, where in that area, do not refrain from eating, drinking, smoking, applying cosmetics in the drug preparation area. You must have to adopt these safety measures. Similar again, you have to see that how well-controlled area under which these drugs are reconstituted. If some accident can happen, then what you have to do? If a chemotherapy drugs comes in contact with the skin, what you have to do, wash the area thoroughly with soap and water to prevent drug absorption into the skin. As I told you, this can be absorbed through the skin also, hazards to the skin. If the drug comes in contact with your eye, immediately flush the eye with water or isotonic eye wash for at least 5 minutes while holding the eyelid open. After an accidental exposure, notify your supervisor immediately. So what happens during that? During if any accident has to be happen, it has to be reported. Safety mail, you know how the waste is disposed of. Because the special type of waste, it has to be disposed of. Now what we have to do, place all contaminated needles in the sharps containers. Don't recap needles. Use only syringes and IV sets that have a lure lock fitting. Label all chemotherapy drugs with the yellow biohazard label. Transport the prepared chemotherapeutic drugs in a sealable plastic bag that's prominently labeled with a yellow chemotherapy biohazard label. Don't leave the drug preparation area while wearing the protective gear up during drug preparations. So you have to follow the safety measures while reconsider or preparing of these chemotherapy drugs or a cancer drugs. The example of semi-sterile, mostly the eye drops or ear drops, and also semi-sterile preparations. These eye preparations are prepared under a sterile aseptic conditions. Similarly, eye preparation also prepared under a aseptic sterile conditions. Now, these have to be various dosage forms of these. Eye drops is there, eye lotions, eye ointments, contact lens solutions, parenteral products, solid dosage forms for eye preparations. They must be free of foreign particles, free from irritating effects, contain suitable preservatives. They must be isotonic with lacrimal secretion. They must be chemically stable. So these eye preparations are prepared under mostly they are prepared under a sterile area. But when you open that one, it's cover over there, you have to apply these drops to the eye. Again, it has to be closed. Similarly, for that drops, for ear preparation, you have drops, sprays, washes. These all are prepared under a aseptic condition, under a sterile environment over there.